Hello, we thought it might be helpful to our friends in the midst of this global pandemic, this great crisis, to look at some of the ideas that Acton has been thinking through over our 30-year existence and see how applicable they are in this circumstance. One of the first things that comes to my mind is, and you see this in business and in society in general, how people want to disassociate business from ethics. In this case, people want to disassociate economic well-being from our health. And of course, these can't be radically separated. They can certainly be distinguished, but not radically separated from one another, because primarily the human person is at the center of the economy. So if you have a debilitating situation where human beings are not well, or their well-being is threatened, this is going to affect the economy. But the other part of that is true too. You have to have a healthy economy in order to preserve the well-being of the community. So in looking at this whole crisis that we are confronting all around the world, I think it's important that we maintain this interconnectedness, that we cannot destroy an economy without considering what the long-term effects of that is going to be generally. And on the other hand, we can't ignore the reality of contagion and think that everything is going to be just fine. So we have to balance these things. Another dimension of this that I alluded to in my previous video is the interconnectedness of knowledge, which is really part of the real concern that we have right now, and the price system. That prices tell us about the relative supply of things, and that when we obscure prices, especially when we build in systems that regularly obscure the price of things, we're flying blind, so to speak. We don't have enough knowledge about what the real needs are and how urgent those needs are based on the willingness of people to pay for things or the supply of those things that people are seeking. So I think that's another part that plays into this whole thing. And you see these ideas that are very familiar to people who follow the work of the Acton Institute apply so clearly to the crisis we're presented. You know, very often I've heard the critique over the years that our ideas are too abstract. They're not appropriate to the real day-to-day world. And now we see how these ideas are playing themselves out, some in good ways and some in very precarious and dangerous ways. Fear generally is the result of not knowing. Not feeling that one has a control over things. I certainly have experienced that as a pastor in counseling people. Psychologists experience this all the time, or you just reflect on your own circumstance, that you become more frightened when you don't know what you're looking at, or when you don't have control over your environment and over your circumstances. So a lot of the crisis that we're facing is that reality. And the market, while it's not the answer to every concern that we have, can help us to feel a little more in control, a little more knowledgeable about it. And this is why we need the kind of research and facilitation of economics to help us with this. Here is what I want to say. This is kind of almost embedded in our knowledge of the world, and yet we don't see it very clearly. It's losing the forest for the trees. But just think of the ways in which the repeal of regulation can enhance the well-being and the effectiveness of our response to this crisis. Now, finally, some states, I'm talking now in the United States, our jurisdictions are dropping the licensure requirement for doctors from one state to operate in another state. I mean, if we need doctors more in one state than in another, isn't it dangerous to be saying that these fully qualified doctors, these physicians, can't operate? Likewise, the regulatory apparatus with regard to medicine and medical care in general can be lowered and not create a dangerous situation, especially when we're in a more broadly dangerous situation, for other healthcare workers to be able to take care of things and allow people with greater expertise to deal with those areas. I'm talking here about something like a pharmacist or a nurse being able to treat and even prescribe certain medications for people, which generally is against the law. You can really be prosecuted for that. So if we drop the kind of regulatory mentality that we have, that constrains our ability to assist others, I think this too can be very helpful. Then likewise, it would be interesting for someone to do a survey of regulations that inhibit all kinds of operations that are needed by various people in various circumstances. I'm thinking here of the reality that there are onerous regulations on business that prevents them from responding in certain ways, forms of taxation. What about a tax holiday for the next 6 months on businesses? Because our economy is being so dramatically affected by this. What if we just say to people, look, let's relieve the worry of people having to pay all of these taxes in various ways. You know, just recently there's a discussion in the United States Congress about stimulus packages, and I saw that there is a 1,400-page document allocating money to all kinds of disassociated entities, whether they're businesses or other governmental entities, that have nothing to do with this crisis. Well, it'd be far more effective to free industry, which is, again, the search for knowledge, the remedy of people's problems, how you confront dilemmas and the needs that people have, to free them from the burdens of regulation and taxation and other kinds of things like that. That's just to stimulate some thinking on our part in terms of how we can go about meeting this need on very practical and local levels. As I say, we'll reflect a little bit more about this, but I want to once again assure you of our prayers. We ask for your prayers. In the state of Michigan, where we're located, we have had to have a kind of lockdown, so we're having very minimal contact. I've kept the doors to my church open so that people can stop in and pray. But in general, the streets in Grand Rapids, Michigan strike me as a Sunday. So we wish you well. We pray God's blessing and the care of his angels on you and your families.